Good morning, ladies and gentlemen. It's my great honor to be here and present my study, real-time optical diagnosis for surgical margin in lower rectal cancer using multiphoton microscope. I have nothing to disclose. As we know, clear surgical margin is very important in lower rectal cancer to avoid cancer recurrence. Multiphoton imaging based on nonlinear optical and femtosecond lasers has been provided real-time detailed information on tissue architecture and cell morphology in live tissue. This picture is what I did by using multiphoton imaging to show stomach tissue from mucosa to submucosa. And this picture is looked at the Yale University in 2007. He used the multiphoton probe to show rectal mucosa in rabbit rectum. So the purpose of my study is to evaluate the feasibility of using multiphoton imaging to make real-time optical diagnosis for surgical margin in lower rectal cancer. 30 fresh, unfixed, and unstained full-thickness surgical margin in lower rectal cancer underwent a multiphoton microscope examination and then went through frozen end HE staining procedure. This picture is show the procedure in OR. We take the distal margin. This is the donut distal margin to multiphoton lab, and this is the multiphoton microscope. This is the laser system to make multiphoton imaging, and then this multiphoton imaging compare with HE stained imaging. So this is the optical mechanism of multiphoton imaging, which include two signals. One signal is from second harmonic generation signal from tissue collagen. We use the red color code. And the other is the two photo excited fluorescent signal from cells. Use a green color. This is the patient demography and cancer characteristic. The median distal margin is 2 centimeters, and the procedure totally 13, and 3 cases with positive distal margin, and the surgical procedure changed from LOR to APR. The difference between negative and positive surgical margin in two photo excited fluorescence can show typical four-wheeler pattern with central round crimp opening and grounds lined by epithelial cell and goblet cell in negative surgical margin. And in positive margin is irregular tubular structure, reduced soma and cellular and nuclear polymorphism. In second harmonic signal, it can be detected along grounds in negative surgical margin. And in positive surgical margin, is significant decrease and loss. Okay, this multiphoton imaging show, this is a negative surgical margin, show the regular architecture and cell morphology. And in positive is the abnormal structure. We can see the big picture here. Negative surgical margin, we can see the grounds. And here is the epithelial cell, and this is a goblet cell, white alum here. And the most important thing is the second harmonic signal can show the basement membrane. This is a red color circle. And in positive surgical margin, cancer cell can be identified by irregular size and shape, and enlarge nuclear and increase nuclear to cytoplasmal ratio. So the conclusion is there are significant difference between negative surgical margin and positive surgical margin using multiphoton imaging. With the miniaturization and integration of the colonoscopy or probe, multiphoton microscope has the potential to provide a real-time, non-invasive optical diagnosis for surgical margin in colorectal cancer in the near future. I would like to thank you, SAGES, to give me this Margaret Traveling Fellowship Award, and thank you for your attention.
This paper is open for discussion if anybody wants to come up to the microphone. Otherwise, in the 3 patients that ended up having the positive margin using this technique, what was their gross margin, and was it different than the other patients? So did they have a smaller gross margin or no?
Yeah, too close, because close, the 3 patients, only 3 patients were male and with close distal margin. One is 0.5, one is 0.6 and 0.8. And the negative distal margin is more than 1 centimeter. So this is sometimes because in these 3 cases is stage 3 patient. So when we do the low anterior resection, and after the circle find the donut is frozen is positive. Yeah. So yeah.
And was the histology of the differentiation of the tumor many different in those patients who had the positive distal margins as opposed to the other ones? Because one of the things that we know is that distal intramural spread, tends not to be more than about 1 centimeter in a well-differentiated or moderately well-differentiated tumor. But in a more undifferentiated tumor, there can be larger intramural spread. So were the histologies on the actual primary tumors all the same or no?
The histology, because after we take this distal margin, first we do the multiphoton image and send to the pathology lab and frozen. The frozen find these things, and also we just compare. We compare these things, and this imaging, the multiphoton imaging is comparable to HE imaging in histology and pathology imaging.
Is there any difference in the Fosun section results? That means in the 3 patients with positive margin,
yeah.
do you find the positive margin in the Fosun section results?
Yes, in this male patient.
So what is the additional information that this technique can give us if it can be shown in the Fosun section, ordinary Fosun section?
So I think the question was, you did frozen section under the microscope in addition to using this technique, correct? You did both.
Yeah, both, yeah.
Right, so were there any patients that either had
difference in the
a difference in the 2 techniques? So did your technique pick up any that the frozen section did not pick up?
Pick, yeah.
Okay. Any other questions? All right,
maybe
thank
a
you very
technical
much.
problem. How long will this technique take?
5 minutes.
5 minutes.
Less 5 minutes. It's very quickly. Yeah, it is fresh. So, yeah, thank you.
Thank you.
Thank you very much.
Thank you.